Hello, everyone. Good morning, good afternoon, and good evening as you join from different parts of the world. We'll just take a moment, maybe a minute, just to wait for everybody to join for the webinar today. But just as we are waiting for everybody to get onto the webinar, just a quick reminder, there is a survey that asks you if you're watching us live. You can say yes. You get extra credit points to watch us live. But those who will be missing the conversation can always watch the recording. And don't forget to drop your question for our guest expert for today in the discussion forum. Okay, let's get started. So hello everyone once again, and welcome to the fourth webinar in the series at Spring 2021 Social Entrepreneurship for Innovation in Health course. As you're aware from the course overview already, Module 4 and 5 are about co-creation, and you will have the opportunity to review real-world and potential co-creation proposals spearheaded by health innovators. This week's module talks about leveraging shared value, and that's exactly what we are going to be talking with Cleophas Chesoli, who is our guest expert for today. Welcome, Cleophas. How are you doing?
Fine, thank you. Thank you for being here, Indrani.
Thank you. Thank you. So a quick introduction to Cleophas. Cleophas is the founder and executive director of Core Health and Wealth International, which is a Kenyan nonprofit organization focused on prosperity for communities holistically by facilitating core drivers around health and wealth. And prior to that, he had spent 15 years at AMPAT, which is an abbreviation for Academic Model for Providing Access to Healthcare. So he's worked quite a bit in healthcare. Apart from that, he has also led and implemented market access and linkage programs for small landholding farmers. So he has quite a diverse experience, and so we are going to hear quite a diverse outlook of lessons from him. So Cleophas, my first question to you is, can you tell us a little bit about your journey as a social entrepreneur?
Thank you for the warm introduction, Indrani. And I'm happy that we're talking to world changes. And my journey really is a personal one because it really informs from the family I grew up in. Grew up in a resource-constrained home. And at an early age, our father was the major breadwinner, passed on, and so left my mother fending for 7 children, me being the firstborn. And so I saw her struggle doing different sorts of stuff to just bring us up, to make sure that we have food. And thanks to her, we all got a decent education, so to say. And that gave me a passion to say that I would love to see more women have opportunity and access. And that my mother should not struggle again. But then I knew she represents thousands, if not millions of women that have to fend for their families, and many poor households also that have to go through a lot of pain. And that is what made me even decide the courses I took, like studying sociology, how society works and what systems can be put in place to create a better world. And of course, developed interest in economics and commerce just to see how best we can build lasting solutions. And that is what informs really my journey in social entrepreneurship. Thank you.
That was quite a journey. I will say that your decisions in life has all been driven by experience. Thank you so much. Also, Cleophas, can you tell us a little bit about how you have founded Core Health and Wealth International? And while you talk, I will request our backstage team to probably, if you are able to show the slides, Cleophas, you can go ahead and we will be able to share the slides on your work.
Yeah, thank you. Core Health and Wealth, as you can see, it's a small abbreviated there. It's Core Health and Wealth International. The vision is to ensure prosperity in all, for all. And the purpose for that is that not just addressing one aspect of development. Like I know, having worked in different organizations, is that sometimes you just focus, if it is healthcare, you just go about healthcare, forgetting the other determinants of health. And so this is to try and bridge that we go to the community and try and address entire aspects of the community. And so our mission is to improve the health and wealth of communities by providing capacity for people to increase their productivity. We focus on 5 pillars: environment, wealth creation, and health as the drivers. As you can see, wealth creation and health as the drivers, and then education, proper governance, devolution, and environment. And then if you move just to the next slide, you'll discover that our function is based on our initiative is that we would like to establish a data collection platform so that we can actually have information about the community, so that with that, the data will have metrics that we can all measure in terms of seeing what is successful. So that is what helped me to, with my friends, to really form into this, so that we are able to really say, can we bridge and do development in a different way? That is, I know it is laborious, it is not project driven. This is going into the community, kind of open-minded, yes, trying to understand what is the need, and working with the community to see if you're able to address the needs, and then linking different resources. There are different people playing in this space, and sometimes it's just a small connection. So core health and wealth is to playing like a convening mechanism where several people.
Thank you, Cleophas. I think we've been experiencing a bit of technical glitch, but don't worry. If we are having continued technical glitch, probably I'll request the backstage to inform me. But let's go on with the next question. I'm sorry, Cleophas. I think during the session we experienced a bit of technical slowdown, but not to worry. So, Cleophas, you have 15 deep years of experience, and we know that you worked in the area of health and food security. You continue to do so. Can you tell us a little bit about the principles of co-creation that you have followed in leveraging shared value with your partners?
Yeah, I would say that in work and partnership, some things that have been of help has been in, first of all, shared aligning vision, aligning interests, so that at least we can all work with a common interest, bringing different aspects of our dreams and mandates as organizations, so that they are able to be aligned in a project or so. And another principle that is important is really identifying the need that needs to be addressed. So really understanding what it is that we are trying to respond to, and then taking initiative to and deliberate steps to really try and convene and coordinate interventions. And so this really calls for aligning self-interests, aligning visions, aligning the objectives. And then what is of essence is aspects of coordination. There has to be a proper coordinations in matters, the different interventions you're doing, so that at least everybody feels there is a mutual interest and a mutual benefit. Because at the end of it, in terms of leveraged or shared value, there has to be mutual benefit, or what we would call win-win for everyone. And everybody has to feel that they are benefiting from the collaboration. And this really talks about coordinating, collaborating, and developing meaningful, beneficial partnerships that would benefit for everyone. So those are they would be the major principles I would talk about in striking a partnership or co-creation. Like I've said, you need to identify what is the need, what is the issue you are trying to address, what problem are you coming together, and then jointly work with the people to align the missions and aspirations, so to say, because everybody has aspirations and desires. So if we tried and met at that point, then we would really say we have reached a level of co-creation with everyone involved. Yeah.
Yes, that's very important. A very important point is that because partnerships and co-creation is directly proportionate to value creation, and value creation is the most important aspect of economic transactions. So very important points that you made. So Cleophas, my second question to you in continuation to the first one is that what are some of the most successful partnerships that you have harnessed, and what has been some of the hiccups? Can you give us an example of like a successful partnership that you have harnessed, and what has been the hiccups in the process of co-creation?
I'll think of two, but I know some of the most challenging in partnership is issues of trust. Trust takes time, and it takes emotional commitment to build. And it also requires a lot of patience and trying also to align mindsets, because as you mean, people have a way of doing things. And sometimes we also, maybe you have coming in, you want to change the world or alleviate poverty, yet sometimes the people you're trying to help have a certain way of doing things. So it takes time to build that trust. It takes time to really share common will with everyone. And the other bit is that it is important to know that at the very initial places, there will be need for handholding. And those are some of the challenges sometimes, that if it is a big organization which has maybe key performance indicators to measure, you may not have that in your whatever set of activities. And that requires that, because doing some of this leveraging and co-creation sometimes lives beyond the financial years or so. I remember one of the things that I would really talk about is the relationship with World Food Program. In some years ago, we were running a feeding program for supporting HIV affected households, and we were proud. We were feeding thousands of people, providing them food. And all this was coming from World Food Program and donations from everywhere. And we discovered that we were actually creating more problem, dependency. And for several years, then people were not really addressing their productivity, but instead they were looking up for support. And I discovered that as head of that initiative, I said, this cannot go on, because we are creating a worse pandemic than HIV, which was dependency, because then able people are not productive in their farms. And so that initially conversation with World Food Program was, what can we do? Are we able to work with these guys so that you for every $1 of food you give, are you able to give $1 of economic empowerment? And we're trying to look at how best to do. And one of the things that did was World Food came up with a very wonderful initiative called Purchase for Progress. where they were linking smallholder farmers to markets. And initially then was, oh, these food beneficiaries will become the first beneficiaries to sell their products. It wasn't as easy as it was, because the mindset was totally different. And so we had to really change their mindset. People that did not have access to competitive market or the marketplace, now I'm happy with the patience. It has taken years, but today I'm happy to report that we have very strong cooperatives now formed by smallholder farmers. We have now farmers that have put up storage facilities right in the rural areas, opening up space for access to other structured buyers. We've seen now a few of the farmers really starting to add value to their produce, generating very meaningful employment for people. If I said it happened as we had anticipated within the time frame, no, it has taken time, and some of those are continuing. And the underscore there is the community has to trust you, the beneficiary has to trust you before they really give themselves to what you're up to. And the same way, it is the vice versa, that the big organization has also to trust the community that they're able to deliver what they promised. Because when you're talking about structured markets, it's not the small volumes. These people have to get minimums, but then it takes patience to build a level of trust. But today I'm happy. I'm seeing farmers selling 1,000 metric tons of food per season in one cooperative, another one selling 600. So people that did not have access before, now today have. And what is it? It is working to build trust. It takes time. And then number two, working to develop a different mindset of doing things, breaking one or two rules here and there. And then another one is patience. It takes a little hand-holding sometimes, from handouts to hand up. It means that we really have to develop patience, that we have to be ready to work with this and ready to also get dirty in all this. Sometimes lowering ourselves to their level before we lift them up, so that we mutually work. And so the mutual benefits of partnerships will be about patience with the different players on that. That's what I can say in a nutshell.
Very important, trust and patience. So I have some follow-up questions. We have a very engaging and active audience. So there are a lot of questions coming from the audience also. So I'm going to ask you a follow-up question to just something that you answered. What are some of the challenges that you faced while implementing co-creation and working with corporate partners? And what are your recommendations to social entrepreneurs and corporate leaders who want to work together to create social impact? And this basically comes from a lot of participants led by Hanan Ahmed from Canada.
Thank you. Social entrepreneurship is a very interesting discipline. From some organizations like ours that are purely on the social mission, working with for profit, for example. The challenges then is trying to marry the different mandates and the different goals of that. So coming purely from for profit, and then we want social mission. We want to change the world. That's what our mostly we would do. But then how do we change the world without, engaging everybody? And then the private sector, the for-profit, the mandate eventually, yes, they are all to change the world, but in a profitable manner. And so one of the challenges is really aligning the visions of both in terms of partnership, so that how do we, as people coming from the social mission, who are driven mostly by how do we make more people benefit, and then from the corporate who want at least have to make business, we have to reach a point that and I think the convergence point is what today all of us are talking about in terms of sustaining gains or sustainability. So we have to converge at the point of understanding that the corporate, for them to be in existence, they have to be profitable. and how do I enable or how do I work and partner in such a level make them profitable and also so that they can continue. And to me, then I also have to start understanding how do I measure my sustainability. It may not be in terms of profitability, but then how do I undertake my mission to make sure that it is sustaining? And so that is an area that requires a lot of deliberate give and takes from both. I have to understand the workings of the for-profit corporation. The for-profit has to understand the workings of a not-for-profit. And I believe at the middle there is where I could almost say the convergence is the social entrepreneur, whereby then we run profitable entities with a social mission in mind. And the challenges there is marrying the two is not easy. More so for people that want to measure the key performance indicators, annual results, and yet you're engaging in a program you're not so sure whether the return will be as quick. So patience, as I've said, is something that goes into, and the need for continuous education. And I'm happy such a program is ongoing. Education to say, hey, there's more to profitability, maximizing profits or shareholder maximization of profit. There's more to read. So shareholders have to start understanding, yes, you may not get 100%, but you could get 80% because 20% has made some good to some place. And then we in the not-for-profit and have also to embrace the mind that how do we build enterprises that are long-lasting? Because you cannot depend on donor or development partners forever. How do we embed in our structure creativity that will ensure that we are continuing making the impact, but in a sustainable manner, at least so that at least the common good happens. And as I conclude on that is that ultimately we all have to reach to a level that our vision in a product is that we want to change the world. And a product in itself is not just a product, it's actually an aspiration and a passion for the creator of the product. And so as it comes out and when we understand that, I think that makes a real meaningful engagement for partnership and co-creation. So the community has a part to play. And what we're encouraging today is not to come out with goodies, to say, hey, we are coming here to solve this. No, we want to empower the community to change their own productivity. And that is now some of the common aspects that we can all agree. But yes, it takes time. It takes a lot of patience. Like I've said before, a lot of hand-holding that is needed because sometimes the people have no steadiness in their expertise. So that's where we all need to come together for common results. Thank you, Indrani.
Correct. Also, I understand that most of our economic theories or our partnerships are based on the logic of goods. The services industry have just been inserted for last probably 50 years or 70 years, and they've just kind of, started growing. And probably we are slowly, as a management discipline, slowly moving towards, theories around co-creation, where services or human is in the center of delivering an impact. So I'll just like to remind our learners and everybody who's watching us live that there are some tech issues. And I will also like to request the backend team that in case of any tech challenges where you see the, you see the camera freezing, please switch off the video to give us better bandwidth, but because we definitely want to hear more about Cleophas's experience and all the lessons that he's here to share with us today. So with that request to our backend team, back to the question, I have a follow-up question to what you were just talking about in terms of how to create co-creation. There's another follow-up question from several participants who are asking that you're a leader, you're an entrepreneur in Kenya who works with local and international partners. What are your tips to improve communication between people with different backgrounds and experiences?
Thank you for that. The channels of communication must be open at all times, and as one of it is to define, for example, what everybody needs to understand. The community requires certain level of information. How do we package that information? It may not be technical, but then we have to tailor it to what suits them. The partner, maybe let's say the vendor, for example, what kind of information are they interested in? So really about that, the tips would be, I would say, continuous communicating, whether understanding the communication needs would be the first place to do. What is the need? Or what does everyone want to know? What does the government want to know? Because they are key stakeholders. What does the private partner that is maybe selling their produce wanting to know? So you package it. Sometimes you don't want to have everybody consume everything about that, but is to pick based on the needs in the partnership. Because definitely, like there's an input company that we are working with, promoting they are selling through our network. So what do they need to know would be how many people are embracing our products, and is our product making sense to them? They may not be interested to know how much maybe the farmers have saved and all that, as much as it may be good, but then would try and limit their information to what would primarily address to them. What do our board members want to know? What in terms of reporting? So there's a lot of work. There's need to really be on a continuous level of disseminating information, relevant information to everybody. We don't just bind that a report and send to everybody. Is to pick what is essential to every person. But definitely, as been said, keeping the channels of communication open is very, very important. So, and understanding what every person in the partnership really wants to know is essential. Thank you.
Great. We also have a question from Daniel from Netherlands, and Daniel is asking, do you have experience in working with government, and what are the pros and cons of collaborating with them?
Yes, our entry cannot be effective without engaging government. However, that's a very bureaucratic process, and a lot of patience, understanding of protocols is really needed. And like I just had alluded to, trying to understand what is it that the government official would want, the protocol, because they're in for regulation, they're in to make sure that the population is not abused or exploited, and making sure that there's fairness or fair trade, and eventually become the arbiter to run to should there be conflict. So keeping them informed from the very onset of what you're intending to do is very important. So if we are in a particular county, making a visit to the gatekeepers in that county, courtesy calls to the government, the governor or the relevant ministers or the relevant players is very important. Just sometimes just keeping them informed and requesting them to participate in some of the public events you have, or inviting them to visit in the programs. If you did that, they feel very respected. You'll have very good support. So very important, don't just get into a product, send out a product without really getting the buy-in or the goodwill. So engaging them through the different layers and the processes is very important. And like I've said, sharing with them what is important information they will need to know. So packaging it in a way that they feel involved through the process. However, I must say that it's a very bureaucratic process that requires a lot of patience to undertake. Yeah.
I completely agree on that point in working with the government, that you have to keep them involved, you have to follow protocols, and also ensure that their involvement is strategic. So there are a lot of participants. You're aware that our learners comprise of BI employees, and there are a lot of BI employees who look forward to knowing more about your work with Making More Health initiative. Can you give some examples of projects that you have developed together under this initiative, Making More Health? Feel free to give examples that will inspire other allies to adopt your tactics.
Thank you. Yeah, we are happy with the Making More Health initiative. I would say we are almost now going into 2 years, because I think if we are to count 2020, the pandemic here, and I'm liking that aspect, because initially it was just an introduction to the community. Visited one school, found children that were learning in very dilapidated environment. I usually make fun that the children saw us through the walls, not through the windows or whatever. And they were coming from all manner, from the window, from the door, from the walls, all that, because there were no walls basically. And so one of the initiatives identifying that was, what can we do to improve that? And so we've put up a school together with Making More Health. So there's a beautiful school. Sorry, I would have showed you pictures very soon, but we will. The beautiful school that is going on. And then through that, we now doing several other co-creation initiatives. We're trying to explore what more can happen. For example, we discovered a lot of people are coming to care very late. They're coming to seek healthcare very late. So one of the things is, can we go out and seek them early? And so with the support of BI, there's been a lot of testing. Over 60,000 people have been tested for hypertension, chronic diseases. But they know their status early, and it's giving them now management platform in time. As we moved along, we discovered that the water people are consuming is contaminated, and you go to the health facilities, you find the causes of this illness is maybe waterborne disease, or maybe food infested. And when we looked around recently, we discovered that a lot of the water is infected with bacteria. And so within the network, we discovered that there is a social entrepreneur with a solar device, water disinfection using solar. And so we've started rolling out that with the support of Making More Health. And as we did so, we discovered that, it's not just the water, because the water now gets contaminated beyond just the bacteria. It is highly acidic. And because of the overflow of water to the water points. And this is a result of overuse of inorganic fertilizers, chemical fertilizers that are high in phosphorus, making the soils acidic. We had done, I think about 5 years ago, a soil test and discovered the soils were acidic. So, and then the water recently, as we tested in the lab, as we were running these pilots, we discovered the water is acidic. So confirming that the soil and the water is acidic. So we discovered that then the challenge is the continuous use of, or improper use, or let me use the word improper use of the chemical fertilizers that are affecting the soils. And that means that the yields have continuous also declining. From a few years ago, it was 30 bags or 30 bags per acre. Right now, you're talking of 15. So it is continued going down because of the improper use of the fertilizers. So what we are trying to do is then to respond to that by helping them reconstruct their soils. Instead of bringing in lime, then we came across one that has already a lime enhanced fertilizer that is organic. So these are some of the programs we are doing. There's a program that we're running with one of our NGO on ground supporting albinos, because albinos have been some of the mostly challenged people. So it is very good that today we have solutions, education, just to empower the parents, the teachers with the knowledge on how to take care of a child with albinism or a person living with albinism. And these are some of the initiatives we are doing. And right now, a few other employees that we're trying to explore. Are we able to do screening for cancer, cervical cancer, so that at least women can be afforded opportunity to know their cancer status so that they can seek it early. For your information, sometimes people are dying of very preventable causes for lacking maybe 200 shillings. 200 shillings is about €2, because they could not find that to reach a health facility. And so sometimes the challenge is the 200 shillings could mean, do I take this child to hospital or do I buy the rest of the family food? So a mother sometimes is faced with some of those challenges. And so what we're trying to say is there a way we can work together jointly so that we really give the people more choices, so that it is not either or, that they can have both. So how do we increase their capacity to, if they don't have 200, can they have 400? And this is where we're trying now to bring in the BI Animal Health Division to come in and help improve the productivity of our dairy farmers so that they can increase more. And some of those we discovered in the rural area, it's not just agriculture. As we've learned, like in the recent past, just since mid-February, women kept saying, you come here, talk about value chains for farmers, we don't have access to land, but we're interested in running our micro enterprises. And so in 4 months, we've mobilized about 600 women who have started just doing small enterprises. So these are some of the initiatives that we are working on with Making More Health and the different partners. We are running hygiene education in schools to try and just make sure that simple treatment of water, sometimes just hand washing. And I'm happy, at least with the pandemic, at least now some simple diarrhea diseases have disappeared because people have now kept up to more disciplines of hand washing. And so we want to ingrain that in the communities. Drinking treated water. Sometimes people look at the water and they think it is clean, but then we're just telling them, hey, we better. So those are the things we are trying to promote. Making sure every home has a toilet, a simple thing as having a pit latrine, to avoid open defecation and things like that. So it is, like I've said, I was saying in my introduction, it is not one thing that you go into the community and do. This, I keep saying that I think development is evolutionary. You try solving one problem, it adds to another. Then as you solve this, you start addressing the other. Like sometimes we're talking to the farmer about his cow. Then he said, my child is not in school. Then you have to worry about why is the child not in school. Then you discover there are many more. Like recently, we went to some school and discovered that some children are not going to school because they don't have wheelchairs. Or if they are taken to school, they can't participate in activities. So we recently just said, oh, we partnered. We discovered somebody else was doing, and with that, we have availed wheelchairs to some of the communities now, giving very crucial, small as it is, but it is now giving access to that child. And then recently, 18 children that were struggling with eyesight, yet very preventable courses at €30, 3,000 shillings to buy glasses. Some of them were almost losing sight completely. So we've tried to avail that with the help of Making More Health, so addressing different bits of here so that we can give access to everybody. Whoever wants education, they get access to that. Whoever at least wants to improve their lives, they're empowered to do so. So really, that is a mission that we are up to in co-creating with the corporates and with the community. So these are some of the things that we are doing. And like I've said, because Some of them are very new. We are yet to really document lessons, but definitely a lot of activities ongoing. We're trying to run a malaria prevention program by helping people grow Artemisia, prevention, because people are dying of malaria. It's a common killer today. And so we want to make sure that every home, like my vision is, can every home just have 5 plants? So if you just made your own tea, and that can be preventive. So these are concepts that we are still exploring, but we're starting to find shape. Just to say, it has to be a holistic approach in development. And I'm happy that Making More Health is risking or daring to go into that without really having a clearer path on what to do, but really going in and finding out. And I would say that is the way to go as a social entrepreneur. Sometimes go in and develop products that are responsive to the need on the ground. Because sometimes programs are developed or products are developed high up there because, yeah, I thought I have this idea. But sometimes you bring it and it is not responding to the need of the people. And so sometimes an entrepreneur's journey has to involve engaging the community, understanding what really is the problem. I know that is laborious, that is very engaging, but I think that's where partnership with organizations like us that are locally based could be beneficial, to try and receive from the ground what are the needs, and then throw up in the system and say, is there anybody that is interested in solving a problem around water, around hygiene, around improved agriculture, around energy, around proper education? So I think that's what, and that's where I can say partnership is happening. And I could really say the biggest work with Making More Health is leveraging on partnerships, which I think is starting to really emerge. Yeah, thank you.
Thank you so much for sharing that example. It certainly is, I think, the best example of co-creation, where I think Making More Health as an umbrella initiative has allowed a social entrepreneur like you to not just kind of respond to certain core identified needs of people, but kind of it has gone on as a chain reaction, whichever needs are coming up or whichever ways people are wanting to work, you have kind of embraced those needs and kind of created the linkages and worked around to create much more impact than probably you would have started at the baseline. Just because we're talking so much about diseases and the way the health is being dealt currently, I have a question for you, which is as a innovator, as a solution provider in the health space, how are you looking at partnerships, and what is most important for you and your organization at the moment in the backdrop of the global health crisis?
Yes, right now with this pandemic is, how do we ensure that people still have access to healthcare? And sometimes because of the challenge and the COVID-19, everybody's talking about it. Sometimes the other ailments have been relegated to the backseat. And so sometimes people are dying, but yet it could be related to COVID-19, yet it could be because maybe they didn't have access to the clinic because of maybe limitation of travel here and there. And so the biggest cause then is, how do we continue care amid this COVID-19? And this calls for really rethinking how we do medicine, rethinking how we deliver services. How do we make sure that maybe community-based services are empowered to avail healthcare to the person as they need? And one of my dreams has been that eventually, are we able to equip the village dispensaries to a level where they're able to respond to basic care? Because sometimes they lack equipment, they lack basic lab tests, they lack basic medications. And so sometimes people have to travel a long distance. And now with the restriction, that has been a challenge. So we have, one of it is, I would love to see a way where, for example, a local dispensary could be equipped to handle primary health and major with simple cases before a further referral is needed to a higher level. The challenge is sometimes you walk to our local village dispensaries and it is just a hole. They lack basic equipment. That is one of it. And then number two is technology seems to be with us in this in COVID-19, because then we have to adopt. The truth is we will no longer continue doing business as usual. There has to be a new normal of doing things. There has to be totally a mind shift in terms of how we do things. And for example, one of it is, can we then, because I've discovered that with the advent of the pandemic, we in town, yes, can have access to some internet and have continue life almost uninterrupted. But then the rural setup, which about 80% get locked out of the rest of the world. So one of the dreams is then, can we create village hubs, technological village hubs, where we furnish villages with basic digital devices and internet, so that they can, anyone wanting to contact a doctor can go to that place. And we can start having telemedicine right into the village. So a doctor who maybe because of the challenge of travel cannot move, of course there are permits given because of essential service, but in case he's overwhelmed, can they diagnose via internet, via phone to that woman out there and help maybe the nurse in the village on how to manage that case. So that calls for really a rethinking of how we do things. And that is really a matter of agility and adaptability to the new norm. And today, I want just to say that technology is not now a choice for a few people or people who will be tech savvy. Technology has to be a right of access to everyone. And I think one of the things we have now then, I think, to join up is how do we make sure that the remote villages are also connected to the system. So because life continues and they have to have access to the rest of the world as we do so. So that is one way of doing things. Call for agility, call for really what I would call a leadership in how we manage some of these circumstances. So yeah, that is what the pandemic is bringing to us, a totally new way of responding to issues. I think today, the doctor can no longer just claim specialty. He has to be ready to share his specialty with somebody else, because sometimes that person who is not their specialty may be the lifesaver of their patient out there. So how do we share that? And that is, I think COVID-19 has shocked us into some reality to really rethink and reorganize ourselves and reorganize how we do business. And is giving us a new normal of doing stuff. And yeah, we either change or perish. Yeah. Thank you.
Indeed. There's a famous proverb that says, every crisis opens door for lots of opportunities. And I think that we are witnessing that at various fronts. So there is one last question from the participants I would like to take and kind of address it to you, because this is very relevant. And I will club one question I have for you also in that. And it is Anna Escobar from BI is asking, we know that all communities and not everybody is very accepting to innovation and change. How do you expect and how do you encourage people to embrace change and keep the motivation when especially things don't go as expected? And my question is, how do you manage risk?
Thank you. And change is not a very easy. In fact, if you say you love change, then it's not true, because change is a very painful process. However, I think one of the motivation for change has been sorry to say, but COVID-19 is one of the motivators for change. That really, if we don't change, then, like somebody say, change will change you. We have to give motivation. I think today everybody is open to new ways of doing things because of the shock that we have all gone through. And I think one of the biggest messages that has been passed on is that really, I know some of the ideas have been on for a long time. Oh, yes, we can do teleconferencing, but because, oh no, I think it is, well, maybe face-to-face is better. Oh no, we need to really rethink our hygiene. We need to think about our health systems. But it has been more of talk. I know I've participated in several where very nice policy papers. But I think this was a good wake-up call for everybody, that now all of a sudden, if you wanted to go to US or to German for better treatment, you then have no access to it. Then it is calling us, hey, can we improve our health system back at home? Can you make sure that the dispensary accessible has basic equipment? Because then no one is from one region to another. And I think it's been a very good call for everyone. And yes, managing change is not easy. Not everybody embraces it. Like I said, it takes trust for people to really believe in what you're saying. And sometimes technology or new changes fail people. They've tried something like that before, it has failed. So you need to understand before you introduce a new one, has such a thing been done before? Has somebody come before and had a product? Did they succeed? What was their failure? So understanding what has worked in the past would be important to see if what you're bringing on is also helpful. And then seeing, is there a comparative advantage for the change you're bringing? But yes, it takes patience. You can be very disheartened sometimes. You can be very disheartened because sometimes you think people would be very warm, embracing, and you discover it does not. And that brings stress. And how do we manage that? It's really, once in a while is to remember that you're still human. You have a life to live. Recoil back to family, recoil back to just enjoying life, spending time with family, doing something out of the norm, going out to do what is not work, just to help improve, re-energize yourself. Personally, I like once in a while driving just into the rural, enjoying the sceneries, enjoying the fresh air, and then come back refreshed. And then connecting with others, just knowing that we are all connected in one way is a very great way of just making me manage that all is well. I think that all is well, we shall be well, and we are all going through this together. And what I think has helped us in this pandemic is that, we are all facing the same challenges, and we either unite and protect ourselves or continue doing things the way we have done, thinking disjointed, and we all perish. So like right now, what is happening in India, we need to show solidarity. How do we do that? We may think it is far off, but in Kenya, we have to show solidarity with them. What lessons do we learn from them? What lessons do we learn from Europe? And I think what has happened is, in removing a lot of tension, sometimes we feel, maybe the West is better off, is that this has really brought our humanness together. That really we have common challenges that we all have to commonly address. And that, I think, is a big motivator. That yes, what Europe, what US, what India, what Asia are all going through is what Africa is going through, and we all have to do that. So a lot of challenges, but I believe this is bringing us more resolute, better, and even more opportunities to serve humanity in a greater way.
Thank you, Cleophas. I must tell you that our audience, they are sending live comments saying that they are very grateful for your kind words and wisdom. And you have actually inspired a lot of them through this webinar. So thank you very much. In interest of the time, we will have to wrap up, but I really, really thank you on behalf of the entire BIN Ashoka team and all the learners for sharing your wisdom. And before we sign off for today, one last question. Do you have any final words of wisdom for our learners?
Yes, I'll just quote and say, believe in what you do, believe in yourself, because all things are possible to him who believes. And if we can, today, I think there's call to believe in humanity more. And let's believe that the little dreams and the little actions we envisage can make a whole ton of difference in somebody's life. What you consider little, just put it out into action. It may just be the next trigger for transforming thousands of lives. So my encouragement to you as a social entrepreneur, and I think my first interaction, I studied and somebody said, so entrepreneurs are the ones that have been responsible for transforming how the world has been. Then I believe that the social entrepreneur will really transform the world being in a humane manner. So I want just to encourage you, believe in what you're doing, and by virtue of your desire into this is a hope and encouraging the assurance that at least we have a hope, we have a future, because there are people thinking better of our world. So thank you very much. I feel very honored to have been part of the process. Thank you.
Thank you very much once again. And thank you so much for sharing all the kind words, all the wisdom. Wish you all the very best for your continued success in your journey of change making. Before we sign off, I would just like to remind everybody that this week we've opened module 4 and next week is module 5. Both are around the theme of co-creation. And you will have, all the learners will have assignments which we expect you to submit. And the early you submit, we'll be able to review and make suggestions if necessary. Next week, we shall be back with the 5th webinar for the season with Mark Shang on another area of co-creation, which is idea development and pitching. So until we meet again, stay safe and enjoy your learning journey, everybody. Thank you.